I'm Dr. Richard Jackson. I'm from the University of California, Los Angeles. I've been head of the National Center for Environmental Health at CDC for 10 years. I was the state health director for California for a couple of years. I've really thought about public health for a long time. And I was very lucky to be appointed by the National Research Council to be chair of the Committee on Health Impact Assessment. When people feel ill, they think that their problems are going to be dealt with by the medical care system, and many times it is. But the amount of disease we're looking at in the United States, we realize more and more that we can't sit at the end of the disease pipeline when people come in with obesity, diabetes, many other chronic diseases, and think we can deal with it just in the doctor's office, just in the hospital. We've got to move upstream. We've got to deal with the environments that are causing these problems. The food environment, where the food that's not good for us is very cheap and the food that is good for us is very expensive. We have to think about the built environments. Children ought to be able to walk or bicycle safely to school. And people ought to be able to get back and forth in other ways than just being in their car. We need to think about the economic environment that people are in. Any decision that we make at a large-scale societal basis, like a transportation decision, has impacts on human health. And so the idea of health impact assessment is that not only should we be looking at the impact of a big decision, a project, a policy, a plan, we shouldn't just look at the environmental impact of those decisions. We've got to be looking at the human health impact, and not just how it affects people at the various extremes of age, the very aged, the very young, but everyone in between, because there is no major decision that we make as a society that fails to impact human health. Now, the important thing about health impact assessment is it's a systematized process, and it picks up data that is quantitative, number data, that's relatively easy to find, but also qualitative. What are people saying? What do the people in this community think about it? And community engagement is extremely important into a high-quality health impact assessment. And when this assessment is done, this information needs to be fed back not just to the decision makers, but to the community. And oftentimes this is empowering, it's enabling for that community to influence the overall decisions that are being made. It's the belief of the committee that we will serve the public better and will actually serve the overall decision process. And I think we actually will end up saving money by engaging people in these decisions much earlier than we have in the past.